Good morning, everyone. Dr. Burton here, coming to you from beautiful sunny Florida, and today we're talking Botox. Botox is a neurotoxin, and in plastic surgery, we use it to smooth out the facial wrinkles, particularly over the forehead and the lateral orbital region. Botox, it goes in and it prevents the muscles from moving, or it decreases the force of their movement. In cosmetic surgery, once again, we use it to smooth out facial wrinkles, but Botox has other indications as well. It can be used for the treatment of migraines, to decrease sweating. It can be used to treat an overactive bladder. But as a cosmetic surgeon, I'm only going to use it to smooth out facial wrinkles. Botox is delivered to the targeted area of the forehead or lateral orbital regions through multiple small injections using a small needle. It takes just several minutes to do. Botox, the results you should see within a few days. It should peak in a couple of weeks, and it's going to last anywhere from 3 to 6 months. What I found out over the years of injecting is that sometimes the first injection only lasts for about 2 months, with the subsequent injections lasting a little bit longer. But on average, Botox is going to last between 3 to 6 months. You'll simply return to your starting point. Many of my patients will come back in for re-injection every 3 to 6 months, depending on their needs. And I recommend doing it every 3 to 6 months. I like to give it a little bit of time so that the facial skin and muscle layer can recover in between the injections. Botox is, for the most part, a very safe, predictable procedure we do in the office, but complications can indeed happen. You can have pain at the injection site. You may have some facial bruising. You may have a slight headache or flu-like symptoms following the injection. Other things that may happen, you may have some facial asymmetry after the injection. Post-procedure care is very straightforward. You can resume full regular activity immediately after the injection. So Botox is one neurotoxin on the market. There are several other neurotoxins on the market as well. One is Dysport, another is Xeomin. These neurotoxins all work very well and are very similar the way they function. There are some slight variations in the different products. They are manufactured slightly differently, and the volume that we inject at the time of the procedure will vary because of the concentration of the medications, and there are some other characteristics between the different neurotoxins. Another difference I've noticed over the years of injecting is that Dysport will diffuse somewhat better, or more so than the other neurotoxins, which makes it my go-to product when I'm treating a larger surface area, say the entire forehead. So for the day of the procedure, you'll come in, we'll talk, we'll go over your medical history, we'll go over any medications you might be taking, we'll examine your face, we'll look at your face facial animation, we'll examine your skin tone, your muscle tone, and then we're going to go over the different options we have to address your concerns. Botox is an option. We'll go over the risk and benefits of the injection, and then we'll carry out the procedure. Another question that I get sometimes, is there an upper age limit for Botox injections? And in my practice, I like to inject up to the age of 65 or 70. In between 65 and 70, I'm going to use caution. Everybody ages differently, so you might have to inject a little bit less or increase the time period in between injections. But there are some physicians who believe that there is no upper age limit for the injection of Botox. Once again, because everybody ages differently. So see your provider. This is Dr. Burton. I hope you enjoyed our brief discussion on Botox today and some of the other neurotoxins. If you have any questions, be sure to leave a comment below, and we'll see you on the next one.